So we are at the end of week 8. Hard to believe, isn't it? I'm sure everybody's in the thick of things now, right? All your classes, trying to get yourself organized for the rest of the term in HESI's. Oh, I need to look at the HESI schedule. Um, I think I'll take a look at the master HESI schedule. Has anybody heard from their campuses about HESI yet? When they're scheduled? No. I have a master calendar that campuses fill out when they're going to be scheduling, what day, what time they're going to be scheduling their HESIs. So it's usually about this time in the term that I can look on there and take a look and see if campuses have filled that part of it out yet. So I just made myself a note. I will look at the master HESI schedule after class today and see if any campuses have put down when their scheduled HESIs are. And that way, you can start at least planning ahead for week 11 when all your HESIs are. So I'll take a look at that today and see if it's up. Okay. Um, what else? So today you should be able to have access to your quiz. I tightened up the quiz settings. So your quiz should be available now that it's 9. There's a 15-minute time limit on it because that's what it's supposed to be. And I have an access code. So I did tighten up my settings. So we'll get to that. Actually, now that everybody's here, Megan's coming in. Maybe we'll do the quiz first and then go through all my other housekeeping stuff. I want to talk a little bit about the HESI prep, and I want to talk a little bit about going forward for the rest of the class for the next 3 or 4 weeks, but I'll talk about that after the quiz. All right, so Clarence, I can't see your face. I can only see your forehead. Thank you. So you should have access to the quiz now, 15-minute time limit, and the access code is my last name, Marvel, capital M, and then ARV as in Victor EL. So go ahead and put that in. Go ahead and take the quiz, and then we'll come back in 15 minutes and we'll talk about the quiz, talk about some other housekeeping things, and then we'll go through all the content. And I do have a Kahoot. Hopefully we can get to that. If not, I'll send it to you in the announcement. All right. Does everybody see the quiz? Head shakes? Yes, no. Okay, good. All right, so go ahead. I'm going to mute everybody. Stay on camera while you take the quiz, please.
Miss Marvel. Mine just says key graded assessment. It doesn't say quiz, and when I click on it, there's nothing, like it won't open.
Why don't you reset it? It's in there. It's in your grade book. Go from your grade book.
Okay.
Professor, what is the access code?
Marvel, Marvel, capital M. And any more questions, just put them in the chat, okay? Okay, everybody done? Okay. Okay, how'd you do? Did you do okay?
Okay. Um, I personally, I like that you changed it to. A lot of people don't like when you can't go back and change your answers, but for me, it gives me less time to second guess myself because I'll be going back changing answers, but I don't know.
Good. I'm glad
Yeah.
that strategy worked for you, Brandy. Good, good, great. Okay, before we go through the quiz, couple things. Hang on, let me check the chat. I have a couple of messages. That was really difficult. Okay. HESI prep. Your HESI prep is due next week. Okay. Actually, in the next two, excuse me, I'm fighting a cold. In the next 2 weeks, you have 10% of your homework grade due. Okay. Week 9, you have your HESI prep, which is worth 5%. And then week 10, you have your vulnerable populations assignment, which is worth 5%. Okay. Your other homework grades are your NCLEXs, which next week you'll have an NCLEX. And I think the last one is in week 11. So the bulk of your homework grade, half of your homework grades in the next couple of weeks. I hope everybody's working on their HESI prep. That was given in week 1, and it was meant to be kind of a work in progress assignment that you complete throughout the term. After today, most of that HESI prep can be completed. All right. And remember, the HESI prep, all those different boxes are topics that are covered on the HESI. I don't know what the questions are, but I know what the topics are. Okay. So you're going to get out of that assignment what you put into that assignment. If you're doing it last minute and throwing it together, it may be more challenging because remember, this is going to be your study guide for your HESI. Okay. So I hope everybody is working on it. If you start working on it at the beginning of next week, it's just gonna, I mean, it is what it is, but it's gonna be a kind of a long and tedious assignment. Where if you have been keeping up with it during the term, you can kind of fill it out as you go as we cover certain concepts. Okay. Questions about that? And remember, your vulnerable populations assignment is your individual assignment. Picking your vulnerable population from your community, from your zip code. Okay, and that's the PowerPoint. Okay, your group project, which by the way, the group projects were fantastic. I graded them yesterday. Fantastic. Great job. Really great job. Your PowerPoint is your vulnerable populations is your PowerPoint. Okay. All right, so Brandy, I need you to come on camera. Skylar, I can't see you. Clarence, I can barely see you. Skylar, I can only see your forehead. There you go. Brandy, you there? There, there you are. That's okay. You were on mute. You're on mute. There you are. Thank you. Anybody have any questions about anything? This is the weekend that I send out my week 9 announcement is really a kind of a blueprint for the rest of the term. It includes week 9, 10, 11, 12. Just try to keep you guys organized of all the things that are due over the next couple of weeks. And this is kind of crunch time. Everything gets busy in all your classes, right? Last exams before HESI preps. Remember, next week, week 10, will be the last week of content. We only have two more after today. We have 2 more concepts to cover next week, and that's it. Okay. And remember that next week is your exam reviews for exam 3, right? The 3 live reviews. I believe they're Tuesday, Friday, and Sunday. So remember that for next week, right? Because we have our exam 3 in week 10. Okay, so you guys will be taking the exam 2 weeks from today. Does that sound right? We're in week 8, right? So 2 weeks from today. Okay. Questions? You have any questions? Okay, let's go through these. Let's go through this quiz. This is our, yes, Rajana, this is our last quiz. No, this is it. There's no more quizzes. You have 5 quizzes. This is it. Okay. All right. Why is everybody so quiet this morning? Is it just early? Well, full disclosure, it's 7 a.m. for me. And I'm not an early person. But, okay, let's go through the quiz. Okay, can everybody see my screen? Yes or no? Can everybody see my screen? I just need one student to say yes. That's it.
Yes, Professor.
Okay, thank you. Okay, so one of the concepts we cover this week is infection control prevention. Really important topic for all of nursing, actually, whether you're working in a hospital, a long-term care facility, client's home. Okay, so which of the following are effective parts? And remember, if you reviewed your notes, this is in there. Which of the following are effective parts or infection control to reduce the incidence of healthcare associated infections? We always know we need to be doing that, right? Personal protective equipment, always hand hygiene. And we need to be following the environmental infection control measures that are put in place for wherever we're working. Okay? We don't need to do C. Okay, any questions about that? Okay. In addition to observing standard precautions for a client with primary TB, what other kind of precautions are you going to want to observe with TB?
Airborne.
Airborne. And this should be familiar to you. I'm sure you've talked about TB in your med-surg classes, correct?
Yes.
Okay. Okay, another question, another infectious disease question. When you're using airborne precautions, which of the following airborne precautions require which of the following? We definitely know an N95, right? This is right from your notes. Private room. Patient should only leave the room for essential activities. Anybody have any questions about that? Boy, you guys are quiet this morning. Hey, Now we're talking about contact precautions. Which of the following medical asepsis principles are sufficient for in the home? Okay, for contact precautions. Right? We know we're using gloves. We know we're disposing of soiled contents properly. Frequent hygiene. We're always thinking about that. No need to change our clothes often. Of course, unless they're soiled, right? Okay. This question also came from her notes. So Sarah, the nurse, knows that the client needs to understand that the HIV test cannot always identify infections that may have been acquired in the previous 3 months before the test. Which of the following statements by the client indicates further need for teaching? So what kind of question is this? What kind of framed question is this? Positive or negative?
Negative.
Negative. Because we're asking for you to select, what do they say that's going to require further teaching? They didn't get it, or they didn't understand it. We need to review it with them. What's the answer?
I said C, but I don't know if I was right or not.
You're right.
Because I think you should. Okay. I was about to say, I think you should have risk reduction counseling if you're in there for testing. Sure. Like, you should know the risks.
Yeah. Well, C contraindicates what's, I mean, it's pretty much in the question.
Yeah.
It's kind of giving you the answer, right? We know that HIV tests cannot identify infections that may have been acquired within the previous 3 months.
Yeah, all the other ones are correct. That's the first. Actually,
Exactly.
that sentence says the first selection at the top. So we know that's right.
Right.
Yeah.
Same with B, right, Brandy? Same thinking with B. Testing could be negative early, right? But may come up. That's why the test is repeated and suggested to be repeated in 12 weeks. Right? So C is assuming that risk reduction is not indicated. Yeah, it is. The test is valid. No, it's not. That's why it has to be repeated. Okay. Okay, disasters. Natural disasters can be devastating to the community. The nurse is providing an annual education class to the community. Which statement by one of the community nurses indicates further teaching is required? So again, a negatively framed question, right? What does she say that is kind of an oopsie and we need to go back and reteach?
Now, I don't know if I got this one right because I haven't came across it yet while reading. So
Yep.
I put B. So I mean, you can't drink bleach. So
Yep. So this is in your notes in your disaster section. Okay. Water can be in your notes. It's 3 to 5 minutes of boiling. Right. It can be safe. It's in the notes, but it's 1 ml of bleach. I think it's like 16 drops that sits for 30 minutes. So yes, bleach. These are in your notes. Boiling, bleach, and water can also be rendered safe when it's removed. Water can be rendered safe for drinking by removing it from heaters and commode tanks. Okay, C is not correct. Right? We don't care that it sits for 24 hours. Okay, and we certainly don't pour it through cotton towels. Okay. So it's boiling, bleach, and removing it from the other tanks. And we'll go through this in more detail when we get to the content section, okay? So C is your correct answer. That's actually incorrect. Okay. All right. What's the big difference between, well, what's the answer here?
I put
Smallpox.
smallpox.
Smallpox. That's the big difference between smallpox and chickenpox. Smallpox, you typically find on the palms of your hands or the soles of your feet. Chickenpox, that's not where they're located. And again, this information came from your notes. Okay. Which actions by the nurse accurately indicates understanding of pardon me, proper management of a client that may have been exposed to a toxic chemical spill. Select all that apply. Which is
All
it?
of them.
All of them. This is a good teaching question about a potential toxic spill, right? Everything applies. Clothing and contact lenses are considered contaminated.
I didn't
Tongs
select
to
that
remove.
one.
Go ahead. What,
I'm
Brandy?
saying like I didn't select that one. Or the eyes should be irrigated for 10, 15 minutes. Cause my thinking was like, they've been exposed. Maybe it's on their clothes, but not in their eyes. So
Yeah.
I don't know. That was
Yep. Eyes are irrigated for 10 to 15 minutes, and obviously clothing placed in a proper disposal bag. So all four apply for a chemical, a potential chemical spill. Hey, so what we learn in home health is that there's a lot of people involved, lot of service providers involved. It's critical the sharing of information from one healthcare setting to or provider to another is critical for community-based care, especially as clients make their transition from hospital to home, which is a good example of this. What's your answer?
C.
C. A makes no sense. B makes no sense. C, maybe down the road, but this is the most important communication that needs to happen as the client's preparing to make the transition, right? Because it says the client's in the hospital and going home. So communication between acute care, which is the hospital, and home health agency staff. Make sense? Last question. Neglect. Right? We have physical neglect, we have emotional neglect. So, physical neglect, failure to provide food, clothing, shelter, hygiene, or what?
Necessary medical.
Medical care. Right? Okay. So, quick evaluation of the quiz. Do you have a better understanding going through it?
Yes.
Yes, no, maybe?
I think
Yes.
I need to go back over like my precautions again because like I knew airborne for the tuberculosis, but I second guessed myself where it was a multiple choice, and I also selected droplet precautions because all I can think about is them like coughing in there, and then those droplets are landing on like tables and their blankets and stuff like that. So like along with all the airborne things like having a private room or vacuum, how they have like the different air in those rooms and stuff, I was even thinking about like touching things. Like I would definitely want all my like droplet precautions covered as well.
It was a pretty
So I
simple
selected
question
those.
though, Megan. You're
It,
adding
it was. I'm
I
just
know,
explaining where I messed up.
I
I know
know.
I messed it up.
Overthinking,
But I
overthinking.
second. Yep. Yep.
Again, remember, I can't say this enough. If the only information you need to properly pick an answer is in the question, right? If it's not in the question, it doesn't exist. So for all of you overthinkers who like to add information, what if? Well, what happened before? What happened? If it's not in the question, it doesn't exist. Make sense? Brandy shaking her head. Yes, yes, yes. Right?
Yes, this happened to me. I'm very overthinking. Thinker.
Well, yeah, I don't know how many times I can. The overthinking is it will catch up. It will catch up. These aren't, with regards to the quiz and even an exam, they're not trick questions. They're not gotcha questions. They're straightforward questions, right? So there's no need to overthink. All the information you need is right in the question. If you start throwing additional things at it, the question, it's going to get confusing. And then I had one good, all my reviews are good, but I met with a student this week and we talked about some strategies. And I'm just going to throw this out there since we're talking about it. My strategy for attacking questions would be read the question, take that highlighter in ExamSoft. All right, this is your first crack at the question. All right, you read it slowly. You highlight any words, phrases, cues that jump out to you, right? And then as you're reading the answers, the first time you're reading the answers, it's not to pick the right answer, it's to eliminate any answers that totally don't make sense. You know that, so you're that line through, right? You know, all what we're talking about, right?
I wasn't able to find that. I looked for it on our last exam and I still wasn't able. The only thing that comes up is the highlighter and the colors of the highlighter.
Okay, has anybody found the line through in your ExamSoft yet?
Yes, I do.
Where is it, Celine? You're on mute.
In tools, you can find it.
Where is it?
Tools.
Tools. Skylar, did you go into tools?
No, I didn't, but
Okay.
I'll try that
Okay.
on our last exam.
Okay. So that would be my strategy. You go read the question the first time simply to highlight. Then you go read the answers the first time simply to eliminate. Right? And then when you go back and reread the question the second time, guess what's there for you? Highlighted words, and maybe you've reduced it down to 2 answers to pick from, or 3 answers, whatever. Does that make sense? That would be my strategy. If I had those tools when I was taking the exam, I would utilize that. That's just my thinking. But it would seem like a good idea to take a real close look at that question. What is it saying that's important? Is it a priority question? What's first? What's last? What's initial? And then secondly, is it positively or negatively framed? Am I looking for something that somebody says or does that's incorrect or needs more teaching? All right. Then you, I'm sure, can eliminate at least one answer from each question. Right? And then go back and your second go at it is to answer the question. Your first go at it is kind of setting it up. Right? Anyway, okay, let's go through some content here. Like I said, I do have a Kahoot for week 7 and 8. If we get to it, great. If we don't, I will send it to you in the announcement with this recording. Okay. I'm a firm believer if Kahoots can be done in many different ways. We can do it as a class if we have time, but I want to cover content, especially week 8 content. I want to cover home care and case management. My students last term struggled with case management questions on the exams, on exam 3. So I want to make sure I review that thoroughly. Okay, so if we get to the Kahoot, we'll do it as a group. If not, you're fine doing the Kahoot on your own. Right? Okay, questions going forward. Let's do week 7. Let's do week 7 first. This is last week's content. Okay. Oops. All right. With regards to infectious disease prevention and control, let's talk about the epidemiological triangle. That's a fancy word for looking at different infectious diseases, communicable diseases, how they play out in the community or in the hospital. But let's think about it from a community standpoint. Okay, so there's 3 parts of the epidemiological triangle. There's the agent, the host, and the environment. Okay, the agent. What's the agent?
The thing that's making you sick.
So give me examples of agents.
A bacterial infection or viral infection. It could be chemically sent too, like anthrax and stuff would be considered an agent.
Mm-hmm.
All the bad pathogens basically are agents.
The flu, COVID, pneumonia. What else? So agent can be whatever the infection is. Like Megan said, bacterial, viral, chemical. The host, what's the host?
Whatever is sick. So us.
Us. Right? We're the host. The agent has to infect somebody. Right? And we have to think about the host with regards to us. Are we healthy? Are we not healthy? Do we have a compromised immune system from whatever? Do we have comorbidities? Right? Do we have good nutrition practices? Do we get adequate rest? Do we get exercise? Do we have other diseases? Do we have good hygiene? Those are all factors that are considered with the host. Okay? The environment. What kind of environment is the host in? Okay? The environmental factors that contribute to how sick people get. Physical environment, biologic environment, social, cultural, right? Environmental factors facilitate the transmission. Okay? So let's talk about some real world examples. Let's talk about COVID. Okay? And I can speak for my school nursing experience because I was deep into the schools when COVID hit. Okay? So let's take 2 scenarios. Let's take the agent is COVID. The host is the elderly. And the environment's a nursing home. Pretty high risk, right? Pretty high
It
risk.
spreads like wildfire in
Exactly.
a nursing home.
Exactly.
Like, and when I saw it, we had like 1 person get it. The next day, it was like 7 positives. Then the next day, it was 14 positives, and it like grew exponentially in the nursing home.
Exactly. So COVID with the elderly in a nursing home was extremely high risk. Right? Think of your population. Think of your host. Comorbidities, crowded place. Okay? Then compare that to Your agent is COVID. Your host is a bunch of first graders. And your environment is the school. Okay, much less likely. Yes, may get it, but be much less sicker. Okay, let's do another example of the flu. Your agent is influenza. Your population is the elderly, or let's say at risk, compromised immune system. Okay, and your environment is a assisted living or a rehab center. Very high risk, right? Versus agent is influenza. Again, a healthy high school class. The environment is the school. May transmit, but the illness of these healthy kids will hopefully prevent them getting super sick. Does that make sense? So the relationship between the agent, the host, and the environment can be just about anything. Right? So let me take a kid that I have in the schools. So the agent is, let's say it's pertussis. Let's say I have a group of kids, the environment is a school setting. The host is, let's say I have a group of kids who haven't been immunized against pertussis for whatever reason, personal, medical, religious exemptions, whatever. Okay. I need to have a plan in place if there's a pertussis outbreak in the school for these immunocompromised or for these kids who are not vaccinated. Because if they contract pertussis, they're going to get a lot sicker than the kids who are vaccinated, or most likely to. Does that make sense? Am I explaining this in a way that you understand? So there's a gazillion different scenarios, right? There's lots of different, there's tons of different agents, tons of different scenarios with hosts, age, comorbidities, even maybe ethnicity. And then there's lots and lots of variables within the environment, whether there's social barriers, cultural barriers, biologic, physical, right? So in order to understand the epidemiological triangle, you have to understand the three parts to it. How the agent may infect the host, and what does the environment have to do with it for how sick people are going to get. I mean, maybe in a nursing home, maybe they did a flu vaccine, right? So maybe that population will be a little bit better protected if there's an influenza outbreak in a nursing home. Does anybody have any questions about that? The difference between epidemic and endemic. Endemic means it's here to stay. Okay, there's a baseline. So the flu is endemic. COVID is endemic. Chickenpox, endemic. Right? It's always going to be around. Epidemic means that even though the flu is endemic, meaning it's always going to be around, we may have an epidemic of the flu this flu season if there is a excess number of cases versus what we expected. Does that make sense? So lots of infectious diseases are endemic, but epidemic means just that particular disease has, or infectious or communicable disease has an increased excess of expected cases over a particular season or over a particular time frame. This was your contact precautions question here in your notes. And then I just wanted to talk about reporting. There are federal guidelines for reporting certain infectious and communicable diseases to the CDC. Okay, so there's federal guidelines that the state follows, right? And then the state informs your local health departments what needs to be reported to the local health department. There is actually a list. Okay, when I was in the schools, we had a reporting, kind of a reporting booklet. And it listed out the 40 infectious communicable diseases that we needed to report if we were made aware. Like in the schools, pertussis, hepatitis, HIV. Those are pretty standard. But not only do the schools report, doctors' offices have to report, urgent cares have to report, any physician or practitioner needs to report, not just the schools. So by the time our health department was pretty on top of things in the big county that I live in, a lot of times by the time I called the health department to report my pertussis case, they already knew about that kid because the doctor's office had already called. So this paragraph is talks about mandatory reporting. Okay, surveillance and outbreaks. In the community, we do surveillance and observation for certain outbreaks. Okay, so think about the nursing process, right? We're collecting information. Let's say on the local college campus, all of a sudden you have a large group of kids going to the clinic on the campus with GI stuff. Some of them end up in the campus clinic, some of them go to the urgent care. Okay. We as community nurses have to monitor that, have to observe that, have to surveil that. Okay, so we're collecting information. We're trying to interpret what's going on. When did it happen? What foods was everybody eating? Where were they eating? I'm just giving you a real life example. Where were they eating? Were there particular foods that were ingested? Do they all live close in the same dorm? Are they roommates? Right? So nursing process, collecting data, analyzing it, trying to interpret it, and then communicating. The kids are saying, can we go to class? Disseminating information. No, you shouldn't go to class. Here's when you should go to class again. Okay, so observation, surveillance is all about identifying trends. So in this case, when did it happen? Where did it happen? How many people are affected? How many kids are affected? What resources do these kids need? Right, and what's our response? That's what outbreaks are all about, identifying them, trying to analyze it, coming up with a plan, right, for rapid response. We hear about outbreaks all the time. Okay? So there's some different patterns of outbreaks I want you to know. And they're right here, point source, intermittent, mixed, and propagated. So a point source outbreak is everybody gets sick at the same time from an exposure. So let's say maybe a release of a gas in an enclosed place, like a train or a bus. Everybody gets sick at the same time. They're exposed and they get sick. That's point. You can point to the source. Okay, where intermittent, it's exactly what it says. Intermittent. Let's say you're at a restaurant and the restaurant has got a bad batch of lettuce. Okay, and this lettuce is served over a 5-day period before they realize anything's going on. So everybody who's had that lettuce has been exposed, but maybe it's over a 5-day period. Okay, so people are getting sick at different times. Okay, mixed outbreak is mixed is person to person. So I'm exposed to the flu and then I pass it on to you. and you pass it on to your coworker, you pass it on to your kids, and then your kids pass it on to their classmates. And the class passes it on to the teacher. Okay? And then the propagated outcome is typically no common source. Gradually, over time, spreads from person to person. The best example is TB. Right? So if you're given a scenario in your next exam, the question may be, what kind of an outbreak is this? Is it a point source? Is it an intermittent? Is it a mixed? Is it propagated? The only thing I want you to know about this next paragraph is that when we're developing programs, community-based programs, teaching programs, education programs, we always have to conduct a needs assessment, right? We have to know what the needs are. And knowing that during this needs assessment, okay, there's 4 stages. Reactive, reactive, inactive, and interactive. I just want, really what I want you to know is as we're planning community education around outbreaks and infection control prevention, obviously the first thing that needs to happen is an assessment, right? Vaccines, we know that vaccines are one of the most effective methods in preventing and controlling communicable diseases, correct? We know, and I have firsthand experience with this in the schools, that there are parents, for whatever reason, that do not want to get their kids vaccinated, and that's fine. That is completely up to them. There's 3 different kinds of exclusions. There's personal exemption, which is, I don't want to do it. I just don't want to do it. Medical, where their physician says, based on this kid's comorbidities, it's not safe for him to have the vaccines. Medical exemption. And then you have religious exemptions. Okay, there are certain religions that prevent or that discourage or that prohibit vaccinations. So if we're talking, number 1, non-judgmental, up to the parents, what we can do is educate them, right? Try and give them information, educate them. Not to try and force the vaccines, but to try and educate them. Like, for example, in the schools, I brought up pertussis. Let's say I had an outbreak of pertussis in the schools. I would have a fast list that I would call, I would know which kids in the school were not vaccinated against pertussis. Those would be the first parents I would call. Hey, we have a case of pertussis in the school. My recommendation is that you probably keep your kid or kids home from school until this passes, because you don't want your kid getting pertussis. But it's up to the parent whether they want to keep them home or send them to school. That's a discussion that you have with the parent. You encourage them to call a physician, discuss it, whatever. Hey, does that make sense? So yes, vaccines are one of the most effective methods of preventing and controlling communicable diseases, but you have to have a plan for the family and kids that are not. One of the big issues that we have that I saw, and it continues to increase, is I talked to one of my teammates in the schools a few weeks ago, and she said we have the highest, and I was in the schools for 21 years. She said we have the highest unvaccinated rate in the schools this past September. And that's a big concern. Big concern. Okay. Okay. I'm going to mute myself for a second and blow my nose. Excuse me. Okay, sorry about that. Okay, all right, let's talk about HIV. Again, these are well, not common, but pretty significant infectious communicable diseases. Okay, are they bacterial or are they viral? That's what we need to know. The bacterial, we can typically treat them with antibiotics. Viral, maybe some antivirals, but it becomes a symptom management. And I'm sure you've talked about all of these in med-surg as well, so I'm not going to go through this line by line. But the few things I want to point out are bacterial versus viral. And I want to talk about syphilis for a second with regards to untreated syphilis, let's say in a pregnant mom. Okay? Because syphilis can be transmitted transplacentally, mom to baby. If untreated and it's transmitted transplacentally, can have significant impact on the fetus or on the baby. Okay, premature birth, stillbirth, blindness, deafness, facial abnormalities, disability, even death. Okay, so we know that syphilis needs to be treated. Okay, if not treated with antibiotics in the primary or secondary stages, it can go to being latent, right, and reactivate later. Okay. Interestingly, about syphilis is a positive blood test. Positive serology indicates that syphilis has progressed to the secondary stage, and it's very, very dangerous. We know that chlamydia, gonorrhea is bacterial, spread through sexual contact, and it can be treated with antibiotics. Herpes, genital herpes. Okay, it's viral. It's incurable. Okay, but I highlighted this here. Actually, I added this here. So let's review this. When we're doing teaching with clients with herpes or genital herpes, right? They need to inform their partners. Okay, clients with genital herpes should inform their partners of the disease to help prevent transmission. We know that petroleum products should not be used to avoid, because they can actually cause the virus to spread. Right? The notion that genital herpes is only transmittable when visible lesions are present is false. It still can transmit. Okay, and then anyone not in a long-term monogamous relationship, regardless of current health status, always needs to follow safe sex practices. Okay. Hepatitis. You need to know the difference between Hep A, Hep B, and Hep C. Okay, Hep A is I'm sure you've gone through this in med-surg, so I'm just going to do a quick reminder. Spread through fecal oral. Hep B is bloodborne. Oops. Hep C is also bloodborne, but Hep C is the one that can attack the liver. Okay. And then HIV. I think we talked about what I want you to know. We know that it's spread through sexual contact, sharing of needles, can be spread through breast milk from mom to baby. Okay. And then here's the information about the 3 months. Okay. HIV testing is antibody testing and can cause false negatives for up to 3 months. Testing should be repeated in 3 months. We went through that in one of our quiz questions. Okay, and a little bit more detail about that the client needs to understand that HIV tests cannot identify infections. It may be infections that may have been acquired over the previous 3 months. Okay. Appearance of that antibody in a blood test can take up to 12 weeks. Okay. And here's an example of correctional facility or a prison. Okay, we know prisons with crowded conditions have lots of opportunistic infections that go on. Most common of those opportunistic infections is, say, a TB. So we need to make sure that an HIV infected people who are living close to one another, so let's say prisons, they have to be screened and considered non-infectious before being admitted to a system like that, because they're extremely high risk for contracting. Think of that epidemiological triangle, right? Let's say the agent's TB. The host is somebody who has HIV, and then they're going into an environment that's crowded. Okay, puts them way at risk. We went through TB in the quiz pretty detail. I want to cover some bioterrorism and disaster management. When we're in the community, nurses are expected to participate in any or every level of a disaster. Whether it's the preparation, the preparedness, the impact stage, the post, we're expected to participate in any of those phases. Okay? Disasters are either man-made or natural. Natural, we have no control over it. Earthquake, hurricanes. But man-made disasters, we do have control over. Air pollution, warfare, fires, water supply contamination. Okay? In the preparedness phase, we may be asked to be preparing families, teaching families how to be prepared for a disaster. One of the areas we may cover with them is how do you prepare a kit? How do you prepare a bag? How do you prepare your family? Okay, and I highlighted this for you. There's a couple things. Stock enough food for 3 days. Check your kit every 6 months for expired items. Make sure everybody knows where that kit is located. Make sure everybody knows how to turn off the house utilities if they need to. And here's our information about water. When is water safe to drink? Boiling 3 to 5 minutes. Treating with household bleach. Adding 1 ml of bleach, letting stand for 30 minutes. Removing water from hot water heaters and commode. Removing the water. Okay, we know that when a disaster happens, everybody is in the impact stage. Okay, during the impact stage, what is our role? Our role is to get everybody to a safe central place. Okay. And here's your information about your toxic chemical. You're an exposure to a toxic chemical. That was your quiz question, right? So one of the other parts of disasters, potential bioterrorism and bioterrorism event. Okay, there's 3 kinds of agents I want you to be familiar with and what they affect. Anthrax, skin and respiratory. Okay, smallpox, skin again, but much more excessive. Okay? And then sarin, extreme respiratory issues. Okay? So those are the 3 I want you to be aware of. So read those in a little bit more detail, but anthrax, smallpox, and sarin. Okay? And then if we think about bioterrorism and disaster, think about food illness, food safety. You know, I assume, as most of you, that when I go to a restaurant, I go to a fast food place, that everybody who is involved in that order, right? Whether it's the cook, the preparer, the transferring of food into a bag. I make the assumption that everybody's doing safe food practices. Do you? I do. Right? They are using good universal precautions, washing their hands. They're preparing the food correctly at the right temperatures. They're storing the food correctly at the right temperatures. They're using gloves or whatever the PPE they need. Right? But if that doesn't happen, we could have food outbreaks or food poisoning or food illnesses. Right? Same with water. You know, I think I brought this up in class, but that movie, Erin Brockovich, right? If you live near water and you live near an industrial site or downstream from an industrial site, there is a potential that the water may get contaminated. And then there's also vector-borne illnesses that we need to think about in the community. Lyme disease with the ticks, mosquito viruses, Zika virus, malaria. There's lots of different things, lots of different categories. Okay. Questions about that? I want to start with week 8. I want to cover home care and case management. Okay. I'm not going to go into detail about care of complex chronic illnesses because I know you've been introduced to all the diseases, conditions that are talked about here, and it should simply be a review. I'm going to ask you to go through that part on your own with regards to cirrhosis, COPD, type 2 diabetes, peripheral artery disease, chronic venous CVI, hypertension. Okay, I do want to cover in depth home care and case management. Okay, what's home care? Where do we deliver it? Where are we delivering care?
In the patient's home.
The patient's home. Okay, there's two things about home care that are individual that stand out. The care is being given in the patient's environment, client's environment, and home care is to individualize clients. That's the two big takeaways of home care. Okay, traditionally in the past, home care would be set aside for, let's see, homebound patients that couldn't leave the home. Think of how much we do now in the home. What are some things we do in the home now that wouldn't have even been thought about 5-10 years ago? That would have been done in the acute care setting. What are we doing in the home now?
Catheters, IV fluids and stuff. I've seen like IV hookups in the home.
What else?
Giving birth in the home. Well, I guess they would have done that still back. I mean,
much more common now.
But it's a lot more common in
What about
like
hospice care?
Hospice care.
Yeah,
There's a good one.
care.
Yeah. What else? Caring for wounds, right? Dressing changes, wound care, PICC lines, central lines, IV antibiotics. Right? What else? So one of the primary functions in home care is to try and help the client facilitate self-care, facilitate independence, right? Because the more we can have them rely on taking care of themselves, the more chance they're going to be able to stay in their home, which is where they want to stay. Right? So yes, they might need some assistance in the home, maybe a home health visit once a week to make sure their medications are updated, right? Maybe they need some assistance with cooking or, cleaning, or some kind of personal aid service. but at least they get to stay in their home. Okay? But the goal is helping them help themselves to stay independent in their home so they can stay there. One of the challenges with regards to home care is the number of people that are typically involved. Okay? Usually there can be multiple people involved, from home health aides to home health nurses to PT, OT, whatever resources they need. Okay? Way back decades ago, the Visiting Nurses Association put together a system called the Omaha system. It's a charting documentation system where everybody can see what everybody else is doing. Okay, so a home health nurse can see how the PT visit went, how the OT visit went, how the nutrition consultation went. You know, if they had a telehealth appointment with their primary care to do updates, that's documented. So that Omaha system, which I'm down here, right? It's meant to organize, sort, and document data so that everybody can be part of that. Okay? One of the other key features of home health services is it's usually dictated by Medicare regulations. Okay, so the home health nurse and the home health agency are very familiar with the Medicare regulations. Also, professional organizations, who's working in the home, what's their level, what's their scope? Is it a personal aide versus an LPN versus an RN versus a nurse practitioner? What's the scope? What can they perform? Right? We may have lots of people in and out of the house. We may have lots of people seeing the client on a consulting basis, on a telehealth basis, and maybe even having the client go into facilities for appointments, right? So it's all over the place. The one thing I wanted to mention is about a nursing assessment in the home. You know, compare yourself doing a nursing assessment to a client in the acute care setting versus a client in the home. Okay, the assessment in the home is much more detailed, much more labor intensive, much more time intensive. Because remember, you're entering into the client's home. You're their guest. You need to be establishing a relationship, a trusting relationship, maybe with the client and their family, or their caretaker, the neighbor, whomever is going to be helping them in their work on independence to stay in their home. All right, we're a guest, right? We need to earn the trust of the family so that they feel comfortable having us come into their home day after day or week after week. Okay. One of the other things that we need to assess when we're in the home, one of the biggest things we have to assess, irregardless of why we're there, we may be there for wound care, IV care, whatever, but we need to assess the risk of falls. Falls is the most common occurrence that we have in home care with our elderly clientele, right? So if you're in the home doing a wound visit, you have to do a safety assessment as well. If you're in the home doing a medication review, medication assessment, you have to do a safety review. It's a requirement. Okay, is the house well lit? Are there rugs all over the place that are slipping? Are there do they need guardrails on their bed? Do they need padded? Whatever. It's your safety assessment. If they're in a wheelchair, how do they get up? Can they get up safely? Are they at risk for falling? Do they need any kind of belt for safety reasons? Okay. So that's our home care. That's what I would like for you to understand, the information about home care. That's what I want you to know. Community resources. We as community nurses are a wealth of knowledge for community resources. each and every person that we work with or meet in the community will likely need some kind of resource. Okay. Meals on Wheels, Red Cross, food banks. I'm talking more about our vulnerable populations, food banks, right? Clothing banks, maybe crisis pregnancy centers, domestic violence shelters, maybe transportation services. What churches provide what resources. There's lots and lots of resources in your own communities, in all of our communities. We have to be aware of those, or we have to know where to go find those resources. Okay. What if you live in a community that has a large non-English speaking population and you don't speak the language or you don't understand the culture, right? Who are you going to try and get to put on your team to help work with this population in the community? Who are your trusted leaders that you can go to? Who works with, let's say you have a Vietnamese population. Who works with this population? Is it a church leader? Is it a trusted community leader? Who can you go liaison with because if you're the community nurse, you're responsible for the whole community. And this may include populations you're not familiar with. So you got to have a plan of who you're going to reach out to help you communicate events or immunization clinics or health fairs, or who are you going to get to help you do that? Okay, so you need to be thinking about that. Pardon me, community nursing is a team approach. You're always seeking out people in the community to help you out. If let's say you're working in a community that has, a high crime rate or gang activity, maybe you're working with law enforcement, right? To help come into the schools, to do education programs for kids. You're always seeking out resources, whether it's for yourself to help with different populations in the community or whether it's for your clients. Okay. And then case management. All right. Case management. Case management is the coordination of care. A case manager coordinates care. Okay. Not every client can be case managed. Okay. Clients that have multiple issues, high cost, high risk, multiple comorbidities. These are the clients that are saved for case management. In every place we work, there's always case management departments, right? You may have case managers that are organizing discharge planning. What does this client need to go home from the acute care unit? Okay. Case managers may be pre-op nurses that call clients. Are they ready for surgery? Go through that whole checklist. Case management is used for a variety of different clients, but typically they're the more high cost, high complex clients that need that kind of care coordination. Right, very time consuming, very costly. Okay, so let's take a case manager. Let's do a couple of examples. You have a case manager of a client, you have a case manager on the stroke unit who handles all the discharge planning for the clients going home. What do they need? Do they need a personal health aide to help cook, help clean? Do they need PT? Do they need OT? Do they need speech? What's the insurance going to cover? What's it not going to cover? They work with the insurance companies. If it's somebody that's going back to possibly trying to go back to work, are they working with their employer? Okay, so they could be working with multiple people, multiple agencies. Okay. Let's say you have two different examples. You have two people that have just had open heart surgery. Okay. One kind of cruises through recovery, supportive family, going home with people in the home that can get them to their cardiac rehab appointments, other doctor's appointments. Okay. That patient would not need to be case managed. However, let's take the other client, complications after surgery, ended up having to go to a rehab for a month, is going home alone. They still need to get to cardiac rehab. They still need to get to doctor's appointments. There's nobody at home to help and assist. That's the kind of client that would be case managed. Make sense? Case management requires several things: knowledge of community resources, insurance, working with insurances, oral communication, written communication, documentation, be able to negotiate. Let's say you have a client that's on your case management load and they've been diagnosed with something, but the insurance company doesn't cover, let's say, the new medication that's real expensive that may help improve this client's condition. As a case manager, you're going to be on the phone with that insurance company trying to negotiate how we can get this patient, and this is just one example, on this particular medication. Does that make sense? You're involved in a lot. You're involved in everything. Okay? Some different kinds of communication that you might be using in your case management activities: collaboration, assertiveness, cooperation, compromising. If you're given a scenario, be able to identify, is the case manager trying to collaborate? Is she trying to be assertive? Is he trying to be cooperative, compromising? So know the difference. There is a difference. They all seem pretty similar, or like collaborating, compromising, cooperation, a lot of similarities, but there are some differences. And this is just an example of varied types of communication that case managers may need to use. And actually, we use it in our everyday lives. Okay. Questions about case management? I would say that we as nurses are always acting, not always, but a lot of the time acting as case managers where we don't really have the title. Like in the schools, I felt like I was a case manager for the really complex students, right? The complex students that had IEPs, that needed lots of different services, whether it be speech or OT or PT, or had a G-tube feeding that was done in the clinic, right? Somebody's got to coordinate and manage all that. So I would work with the special ed team to make sure all these services that were identified in the IEP, the individualized education plan for this chronic or complex student, got done. So essentially, I was case managing these complex students within the school system. Does that make sense? So, the only thing I wanted to cover in caring of the complex chronic clients was delegation with regards to the LPN, the LVN. You are always going to be delegating, right? You're going to be delegating to, not always, but if you're delegating to unlicensed people, UAPs, there's a couple things that need to happen. Okay? Think about it. If you're delegating, they're working under your license. Okay? What needs to be done? How is it supposed to be done? How do you want things documented? What do you want them to report to you? What are the red flags they need to come and let you know about? And of course, we would never assign a unassisted UAP to an unstable patient. And in the schools, I delegated a lot as an RN, delegated a lot, right? But there were times over the years that I had to pull delegation, meaning back off on it, because in our school system, we had clinic aides that were in the clinics. They did medications. We delegated, taught them, delegated how to do medications or how to do certain procedures. There was a handful of times that I had to pull a delegation. No matter how much training and competency training and education I provided, there were still mistakes happening. I had to undo the delegation. So you got to be careful, because as LPNs, you are going to be delegating, right? The rest of this document is your complex chronic illnesses, that hopefully will be more of a review than anything that you've covered in other classes, particularly MedSurg 2. At least that's what I heard from the last two groups this week. So do you guys have an understanding of home care and case management? Yes, no? Is it clearer now?
Yes.
Okay. All right,
Yes.
because I wanted to spend some time on it, because like I said, there were a lot of missed questions last term on exam 3, and a lot of them were case management. So I wanted to make sure I did a more detailed dive into case management. Okay. Okay, we're about 5 minutes over, so I apologize for that. Does anybody have any questions? If you received a mid-mod assessment from me over the weekend and you still haven't reached out to me, reach out to me to schedule a time. If you score below a 78 on exam 2 and you got an email from me asking to reach out and you haven't yet, I would appreciate it if you would reach out. And lastly, if there's any help you need going forward with exam 3 or HESI or tutoring, or you want to review things, just please reach out. Okay. We're in kind of a critical part of the term right now, and not just for this class, but for all of your classes. Everything's coming together kind of like a freight train, right? Everything's coming together. So I want to make sure that you reach out if you need any assistance with this class, because I know it's going to get super busy I know it has been, but I think it's going to get even more intense over the next 3 weeks. Right? So I acknowledge that and just offer any assistance I can be to get us all over the finish line. We all need to get over the finish line. Okay? Okay. I hope you guys have a great weekend. You know where to find me. Oh, we didn't do the Kahoots. That's fine. I'll send it in the announcement with the recording, and you can do it on your own. Questions? All right. Well, you guys have a great weekend, okay?
Good weekend.
You too.
Thanks.
Thank you.